I would like to talk to you about osteoarthritis or spondylosis. What both of these words mean is wear and tear, and when we're talking about spondylosis, we mean wear and tear that's affecting your spine. Okay, it's very, very common. A lot of people are going to get spondylosis or wear and tear in the spine, but it's crucial that you understand that it's almost normal to get some wear and tear in your spine. What isn't normal is having pain from it, because nobody should have to put up with pain if they actually have wear and tear. It's quite an important distinction. And I'd like to show you what we mean by wear and tear. If I show you two little models, these are two lumbar vertebrae which have come from the bottom of your back, one of the most common locations that we get wear and tear in. Now normally, if there is no wear and tear, you've got a nice thick disc sat between the vertebrae and lots of room for the nerve to come out in between. In advanced wear and tear, what you're going to see instead is a disc that's very much worn down, joints around the back of the spine that are very worn down, and the little nerve that comes out from in between the vertebrae, don't forget that goes into your leg, that is going to be quite compressed and under pressure. Now, this is quite easy to see, but it's another thing to understand how it actually works. And what we find as chiropractors is, if we look at anybody, look at the back, even if they have that much wear and tear, believe it or not, there's always going to be a way to improve it. And that's because once people have got that amount of wear and tear in the back, they're also going to have a spine that isn't working properly and isn't moving properly, or is stuck out of alignment. How we help is by treating people's backs with hands-on chiropractic techniques to get things moving again and to get things working again. If you do that, the body will start to recognise that it's working better, and a lot of the pain that people have will start to disappear. Now, I must stress, I'm not wishing to say for a second that we treat wear and tear or arthritis, but what we've found in the last 20-something years that we've been here is that most patients coming to us over 30 already have some wear and tear in the spines, and yet, when we treat them, they get massively better. So, if you or a relative or a friend has been told you have arthritis, you have spondylosis, or you have wear and tear, and you have to live with it, and it's only going to get worse, that's actually not the case at all. It's very much untrue. And at our clinic, we've seen literally thousands of people with osteoarthritis, with spondylosis, with wear and tear, get massively better with the right chiropractic treatment, partnered up with good lifestyle advice such as exercise, the correct diet, the correct mindset. So if this is something you've been suffering with and you would like to know a little bit more, please give the clinic a ring and I'd be more than happy to speak to you in person. Thank you very much.